I knew pathology was for me fairly early on. My career path was sort of non-traditional in the fact that I was a medical laboratory scientist before going into medicine. So I had already seen some of the clinical pathology aspects.
I had the unique experience of coming to U of M Department of Pathology as a fourth-year medical student. I actually applied to do an away rotation here for 4 weeks, and I was that wide-eyed medical student kind of ready to take on any case we looked at.
For the physician scientist training program, at least at this institution, they ask that you focus either on AP, which is anatomic pathology, or CP, which is clinical pathology.
The focus on education here is superb. We have great didactics, and we have a faculty that are very devoted to teaching you both at the scope, through references, through teaching sets, and however else they can.
Basically, from my first sign out, I felt comfortable, I felt included.
The environment around you truly reflects, how you feel. It has an effect on your wellness, and it also has an effect on the quality of work and the quality of education that you are getting.
Of course, in choosing to apply here, there are already several aspects of the program I was very much interested in.
People are very willing to look at cases, talk about their research initiatives, or just talk about their life. It makes you feel very, very supportive, like you're sort of in more of a family environment.
So being in this space and having all these resources around us really helps us, navigate daily cases and also navigate daily challenges.
You can attend these these scientific symposia that the University of Michigan has here. You have the opportunity to talk to faculty about, their projects, and often you'll realize when you're talking to them that they have questions that you're in sort of a unique position to answer.
I think the most rewarding aspect of residency so far has been seeing my medical school knowledge transition into real patient care.
I would say you should consider the PSTP if you love research and you can't imagine a career without research as a very integral part of it.
If you are interested in pathology as a residency, you should definitely consider U of M Department of Pathology because of the wide variety of cases that we receive. Not only do we get surgical in-house cases, but you also get a taste of the transfer consult services that we have. Whether you're going into private practice or an academic setting, you have all the tools you need to succeed.